and welcome to our virtual symposium, Entering the Rheum, Preparing for Your Doctor Visit and Beyond. I'm Annika Hazlitt, a member of the Board of Directors at Kaleidoscope Fighting Lupus, and your host for this symposium. Today you'll be hearing from two experts on this topic, Dr. Sharon Dowell and Arnita Roberts-Christie. Dr. Dowell is a practicing rheumatologist and professor at Howard University Hospital. She is truly committed to helping those living with lupus. In this symposium, she will discuss one of the most important topics for any patient, how to get the most out of your doctor's visits. Everything from how to prepare before your appointment, tips for what to do while you're there, and what to do after your visit. Arnita Roberts-Christie is a registered nurse and patient engagement liaison with GSK. She's a passionate champion for those with lupus and has a wealth of information about the tools and tips for being an informed and engaged patient. Before we begin, we would like to take this opportunity to thank our presenting sponsor, GSK, for making this event possible. So now, let's hear from Dr. Sharon Dowell.
Hi everyone. Thank you for that wonderful introduction. I am so happy to be here with Kaleidoscope Fighting Lupus to talk about what I consider to be one of the most important topics, and that is how do you best prepare yourself for your doctor's visit. And I would say this isn't just for those of you who have lupus, but this really is for everyone who has to go to see a doctor. It is really important to think about what you would need to do to get the most out of this visit. As I thought about preparing for the visit, I thought about what would be needed before the visit, during the visit, and after the visit. Now, my only disclaimer is that I will be discussing this from a rheumatologist perspective. And so my ideas may be somewhat limited in that fashion. And although I have been a patient myself and can certainly relate to some of the things that need to go into a doctor's visit, my perspective may be limited and may not include all the nuances that you may encounter. Having said that, I think it's important to have the discussion, and I also think it's important for us to empower ourselves as we walk into the room to see our doctors and to leave the room feeling very satisfied with the interaction. So before the visit, there are a couple of things that we all need to do. Number one, make sure to put a reminder on your phone about when your visit is, and not just the date, but the time as well. Check to make sure that you have a number to contact the doctor's office and save that number with your reminder. Also, if it's a new visit and you're going for the very first time, ask for directions to the office and make sure you have those directions saved. You do not want on this very first visit that you are lost or that you're late and you arrive to the visit frazzled and feeling very anxious about missing your appointment. So, because that's important to be in the best frame of mind to deliver information and to receive information. If you can't make your appointment, this is one of my pet peeves, make sure to call to cancel. It's just really good courtesy, and by canceling, you allow your doctor to make room for someone else who also needs to be seen. Before the visit, make sure that you keep a record or a diary so that you can record the symptoms or the problems that you want to discuss. And we all know this, that there are things that we think we'll remember, but then when we get in front of our doctor, we actually forget. So if you have a continuous record and you keep journaling or making a point of the things that you want to discuss, then you can take it with you to your visit and you can have those points in front of you. Some of us will do that on our phones, and others will, if you're more like me, more old school, you'll probably have a notebook that you take with you from place to place. So it's just really important to record those symptoms that you have. Also, make sure that you know your medications because your doctor will want to know exactly what you're taking. Now, this is really important to us. Number one, if you're a very new patient and we want to prescribe you a new medication, we would want to make sure that, number one, it's not something that you've already tried before, or that it wouldn't interact or cause you harm, because some medications cannot be used together. Some medications can make others more powerful or stronger, and some can actually diminish the effect of others. So we really like to know exactly what you're taking. And you can do this in many ways. One, you can make a list of your medications that you walk with, and that can be on your phone. You can take pictures of your medication bottles, or some patients actually bring the whole bunch or whole bag of medications with them, and that's okay. We take the time and we go through each one individually. Also, if you have a concern about a medication in that it's affecting you in some way, make a note of that as well so that you can share that with us immediately. And that's just really important for medication management. On the same note, we also want to know where your pharmacy is, and so you should also have that recorded or have that written down somewhere. Additionally, if you have lupus, you're probably seeing like many providers. You're probably seeing a rheumatologist, maybe a dermatologist or the skin doctor, someone for your kidneys, your primary care doctor. You may be going to physical therapy, or maybe seeing a neurologist or a nerve and brain doctor. So you have a lot of doctors who need to collaborate and communicate with each other to make sure that they are planning for the best possible outcome for you on all levels. And so to do this, they need to talk to each other. And so they need to know who the other doctors are. And if they're not in the same institution, you need to make sure that they are in contact with each other. So to do this, you should have a list of your doctors that you bring to the office visit with you, and also have their contact numbers and their fax numbers so that the doctors can communicate. Even better, if you can get a visit summary from each visit and just have that record with you to share with the doctor that you're currently seeing, that would be very helpful, because then it keeps us all on the same page and we know what's happening on all levels with respect to your health care. And with that, I would also say that a lot of offices now have technology or patient portals where you can see your medical records. Currently, it's very limited, but the goal eventually is that there will be a portable medical record that you can take with you. So if you haven't already done it, please sign up for the patient portals at the various offices that you go to, so that you can have access to your test results and visit summaries that you can therefore take with you when you see your doctors. And make sure that you are best prepared to communicate with your physician. So if you need an interpreter, request that ahead of time. If you're someone who needs hearing aids, take them with you when you go to see your doctor so that you don't have to have someone yelling trying to communicate, but you can communicate more effectively, because that's really important. You want to use that time wisely. And lastly, make sure that your insurance is active at the time of your actual doctor's visit, and that you have a referral if that is required for a new visit. It's so difficult to make these appointments, and you spend a lot of time preparing for it. So you don't want to get there and realize that you can't be seen because of something as minor as this. So make sure you check those details ahead of time. Now, when you actually get to the doctor's office, the first people you will encounter is the staff. So you need to make sure that you are seen and heard, and that you sign in appropriately. You let them know your name and how you prefer to be called, because that's very important for us as well. And then verify that your information is correct, and especially your contact numbers. Sometimes a number or so may be off, and when the doctor tries to call you after the visit, then they have difficulty getting in contact with you. So just verify that information. And again, a plug here for the patient portal. So ask them if there's a patient portal and how you can sign up for that, and maybe do that while you're waiting in the office as well. Now, next you'll go into the room to see your physician. And I'll tell you some of the things that we really appreciate when we see you. We appreciate when you can clearly explain your problem, and when you're clear and concise in describing any new issues. If you have a pressing concern, please bring that up early in the visit. So often, patients remember something really important just as they're about to leave, and then we don't have enough time to fully address that issue. And this is where bringing your notebook in with you and prioritizing your concerns and talking about those, concerns will be very helpful, because your notebook can serve as a reminder for the things that you want to discuss. If you are forgetful, or if you get very anxious when you're in front of the doctor, then you can consider bringing a trusted friend or family member with you to help facilitate this within the doctor's visit. And this helps in many ways. Number one, if you've forgotten something, then they can serve as a reminder. And number two, during the doctor's visit, you're actually learning and gaining information as well, and they can help remember some of that information. For yourself, don't be afraid to take notes when you're seeing your doctor, because we actually know, studies have actually shown that we forget more than 50% of what is actually said in the visit. So when you're there, ask permission, let them know you're taking notes because you don't want to forget and you want to be able to discuss this information and think about it after the visit. When it comes to the physical examination, we like to encourage you to wear clothes that would allow us to do a full examination. Now, if you have lupus, you know that it can affect any part of the body. And so when you go to see a rheumatologist, we do a full examination on most visits. We want to see your skin, we want to see your joints, we want to see your hair and your scalp. So things that can sometimes create barriers or problems is if you go to the visit with heavy makeup, or if you're wearing weaves and extensions. We want you to be beautiful as well, but just bear these in mind when you come in to see us. And if you're wearing tight clothing, then we may have to have you get undressed fully so that we can do an examination. That can then take up time that can be spent discussing your issues. So if you wear loose clothing and we can have easy access to your joints and to your skin, that's probably optimal to facilitate a faster and more efficient visit. When it comes to discussing your treatment and the plan of action, as we like to talk about it, really take notes here so that after the visit you remember exactly what you've been asked to do. And you can sometimes ask the doctor permission to record this portion of the conversation, because it's so important that you know exactly what you should do afterwards, and we don't want you to forget this. Keep an open mind about any therapies that are suggested. Too often we hear about friends or someone who's had a bad experience with a particular medication, and so we cross that off of our own list for ourselves. But if you have a concern, discuss it so that you're making a decision with all the information that you need to make that decision, and not because of any sort of preconceived notion. Because we all are different people and we all react differently to medications. At this portion, it's also good to just sort of repeat and verify that you've heard what the doctor has said, and also ask for a written list of those instructions. And actually at this point, you could ask for a visit summary so that when you leave this visit, you have this summary for your records, and that can be shared with other physicians as well. And this is part of that sort of continuity of communication and collaboration across all the different doctors that you're seeing. Lastly, you can also request from the office a copy of your most recent test results and imaging studies, again, so that these can be shared across all of your doctors, and this will help to complete the records that you're keeping for yourself. So we're sort of doing like a physical portable record until we really get access to that mobile electronic record, which is coming in the future. Now, after the visit, you have to make sure to schedule your next appointment immediately after the visit. In fact, I would encourage you to do it before you leave the doctor's office. I think some of you may have encountered that problem where maybe you're like, okay, yeah, I'll call and I'll schedule that appointment. And then time goes by, you're like, oh shoot, it's time for my appointment. And you call to make that appointment, and the next available one is going to be like 3 months later. And with that delay in being seen, you may run out of your medications, something else may happen, which can lead to a flare of your lupus. So it's really important that you make sure that you are in the system and having a come-in follow-up appointment in a timely fashion. And also try to schedule any tests that are ordered as soon as possible, given that you're there already. And I would say when you go to see your doctor, make sure you have enough time for the visit and then to go and do any test that the doctor orders. Too often people are in, and I know all circumstances are all very different, but too often we are rushing in for that visit and then rushing right back out to go to work or do something else, and we don't put in enough time to do any sort of test that may be required. And then that delay again leads to delay in care. So just try to, if you're going to get that time, make sure you put enough time to do some tests as well afterwards. And again, ask about the patient portal before you leave and sign up for that patient portal so that you can have early access to your results and be able to share with other physicians as well. Now, before we sort of wrap this up, it will be remiss not to talk about telemedicine. Telemedicine is here to stay, whether you like it or not. Some people find it to be an opportune convenience. Others really don't like it and want to go in and see their doctors in person. But there is a role for it. There's a role for it if you have a job where you can't get the time off to go see your doctor, and you can maybe during a lunch break be able to log in for a telemedicine visit. There's a role for it if you live far away and it's a very long commute to see your doctor. There's even a role for it if you need like some emergency advice, although we really do like that emergencies or urgent visits be in person, but it could be like a quick advice session. So there's really a role for telemedicine. So one thing to check is to make sure that your insurance does cover the telemedicine visit, and also inquire about which types are covered, because telemedicine can be a video or audio visual visit, or it can just be a phone visit, and some insurers do not cover the phone visits. So make sure you know about that and what your co-pays will be so there are no surprises. Before the actual telehealth appointment, you should clarify with the office staff how the appointment will be conducted, what technology will be used, what software will be used. Do you need to download any apps in order for the visit to be conducted, so that you're fully prepared at the time of the appointment. Also, make sure to set aside time for the call. And this is really important because too often I have experienced that I would call someone for a telemedicine visit and they're driving down the highway, or they're in a grocery store, or walking their dog, and that's not appropriate. So I will have to reschedule, because I need to make sure that you are in a quiet and safe and private environment so that you feel psychologically safe to have an unguarded and open conversation with me, and also so that we can do any sort of examination that can be done over the video. So look for areas where you have good lighting and try to optimize your internet connection. And in respect to that, some things that can help is if you have your device, fully charged and even plugged in, because sometimes when you're using video, having the device plugged in can actually help with the transmission of a good quality video. We like video calls best because with the video calls, I can see you. I can see your skin. I can even take a look at your joints. Sometimes we even have patients press on their different joints to see if there's any pain and tenderness. So we can do a lot. We can check, range of motion to see how your joints move, to see how easily you stand or sit. So video calls, I know that they don't really replace the in-person visit, but they can really gather a lot of information, and we find it helpful for interim visits. The one thing that we do caution against is that, with telemedicine, if I know you well and I've seen you at least once, I feel comfortable with a follow-up visit on telemedicine. A new patient, I prefer to see you in person, but it can still be done as a way to gather information and then have a soon follow-up visit in office for a full, examination where I can sort of touch you and touch your joints and see exactly what's happening. But overall, I think it's really important to spend the time to prepare for the visit. And this helps you and it helps the doctor, it helps me. In one way for you, by being fully prepared, it leads to a more efficient process. You get all of your questions answered, and you can leave that room feeling empowered and fully satisfied. And for me, I also as a doctor, I feel as if I feel satisfied that I've answered your questions, and I know that when you leave the room that you have all the information that you need, and I feel as if you're organized enough to take good care of your lupus. So I really hope that this discussion helps, and I want to thank you all for listening, and of course I thank Kaleidoscope Fighting Lupus for all they've done to support our patients with lupus in fighting this disease. Thank you.
Thank you, Dr. Dowell. I think we all learned a lot, and I know I'll be more prepared for my next doctor's visit. Next, we'll hear from Arnita Roberts-Christie. As a registered nurse and patient advocate, she has a wealth of knowledge and some great tools for preparing ourselves as patients and getting the most out of our doctor's visits. Welcome, Arnita.
Hello, everyone, and thank you for being here. Thank you, Annika, for introducing me to all of these wonderful people on the other end of this virtual presentation. As Annika said, my name is Arnita Roberts-Christie, and greetings from GlaxoSmithKline or GSK. I especially want to thank the Board of Directors at Kaleidoscope Fighting Lupus, with special thanks to Greg and to Tori for their endless time spent with me as we have been providing these videotape educational programs to you. I do hope that you listen to each of these programs to the end. I also hope that you share these programs with others. There is a lot of information. Take the time, if you can't sit through it all at one sitting, come back and view the rest of it. And also invite your family members and friends, because the more people that learn about lupus, the more that we are able to early diagnose, the more that we are able to get people on treatment that works for them, as well as the more people that you can include in your village to help you live your best lupus life. So before we continue, I also want to make sure that this presentation is not meant to take the place of you having a very open and honest conversation with your healthcare provider. That relationship, that conversation is so critically important to them helping you, because they can't do it alone. Every person that is diagnosed with lupus is every person that is diagnosed with lupus. No two people are the same. And so no two treatment plans are the same, no two treatment patterns are the same. So in order to do what will help you the most, we need you to be very open, transparent, and communicative. As we talk about preparing for your doctor visit, we're also talking about how you manage your lupus. And so in order to manage your lupus, there's a lot of different things that are involved in it. There's a lot of different, I think of it like an octopus with a lot of different tentacles. And one of these tentacles is managing your lupus, and one of them, which is a big one, is how you engage with your healthcare provider. How do we manage that part? And then we'll transition to talking about telehealth towards the end of the presentation. Every day with lupus is different. And it's so important that you, as well as your caregivers, remember I said I want you to invite people to look at these presentations. It is important that you and your caregiver be proactive. So how do you be proactive? Put my glasses on so I can see, right? So your role, you have a critical role in your healthcare. Your physician cannot do this without you, because you are the center of care that is going to be delivered. You are the center of it. And so being an engaged patient is being really a patient that's informed about your health, about your journey, about all of the information that goes into your disease. And statistics have shown that that can lead to better health outcomes. By actively managing your lupus symptoms, you and your healthcare team could reduce the risk of severe flares. And that's really what we're trying to do to help you live your best lupus life. In order to do that, though, we've got to manage what we can manage. So if we were to look at what is an engaged patient, there's 4 different areas here. An engaged patient is one who really takes ownership of their lupus journey. They really say, okay, this is my life, this is my lot in life. How am I going to move forward from where I am? And so one of the things that you can do, one of these 4 pillars, is that you educate yourself. You educate yourself, you educate your village around you, and that's what you're doing here today, is you're getting education. Monitor and track your symptoms. It is important to write down or use your computer or your phone to just keep a record of what your symptoms are like and what you're experiencing on a daily basis or even on a weekly basis. Communication can never be overstated. And the communication is really a two-way street. You communicate with your healthcare provider and they communicate with you. And that is the relationship that I talked about in the beginning that is so critically important. And that has to be, if you're in a, if you're working with a physician and you feel like they don't hear you, then it may be time to share with them saying, doctor, I feel like I'm talking to you, but I don't feel like you're hearing me. You are empowered to do that. That is your right. And if that relationship is not working for you, then you have to find one that does, because that relationship really impacts the type of care that you receive. And that type of care goes to the next stage of helping you live your best lupus life. Okay? So make sure that you're communicating in that it's a two-way street. And then taking ownership of your health. You're doing that because you're saying, I'm going to become educated. I'm going to become knowledgeable, and we know that knowledge is power. I'm going to write down my symptoms and keep a log of it, because we know that when we share that information, it's going to help your healthcare provider help you. And that all comes under communication. That two-way street has to be there. And even if you bring in a loved one or a healthcare advocate for yourself, there's still got to be then three-way communication or four-way. But the important thing is that communication has to be there. And so how can journaling help? I talked a little bit about tracking your symptoms, but journaling is really is an expressive way to write down what's on the inside. Many of us, when we have a chronic disease or when we're stressed or we're going through something, we keep everything inside. And that may be good for a little bit, but if we don't share that, if we don't let others know what is really going on in our life, they won't know. Sometimes they're not able to read our nonverbals. So we've got to verbalize, or, I tell my kids, I said, write it down and then leave it somewhere that I can read it. But we've got to have that communication. We've got to express ourselves. And then writing can help you organize your thoughts. It is shown that it can actually reduce stress and help you manage the uncertainties of lupus. And then over time, your health journal can help your healthcare provider get an accurate picture of what you're going through on a daily basis. You can write it down in a book. You can have a calendar, keep smiley faces, upside down smiley faces, a smiley face with a little squiggly line, which means I don't know how today was. But the important thing is that you document how you are feeling. There's no set way, but what we're asking is for consistency. Find a format that works for you. Start with your health history and the goals that you want to achieve. Make it a part of your routine. If every morning you get up and you have a cup of tea or you have a bowl of cereal, and keep your journal right there and just go for it. There's no set way of what needs to be written down or typed in. The important thing is that you start and that you continue. You can also write down, well, today I went outside and it was sunny and I did not put on sunscreen and I have a rash now. And so that lets you know that, okay, if you're going out at a certain time and ultraviolet rays are really high, that you need to put on sunscreen in order not to have that trigger or in order not to have that flare. Again, with the communication, it is a necessity. There's no two ways about it, no way around it. We've got to just go through it. And for lupus warriors, there are many people that are involved in your care. And it's important that you are open and honest with each of those people in the different settings. So whether it's at work, whether it's at school if you're a student, whether it's in your after-school program, or it's with your group of friends that you've been hanging out with for a long time, and now that you're diagnosed with lupus, things have changed a bit. You may not be hanging out with them as much, But they don't know because you haven't shared with them that you've been diagnosed with lupus. Let them know, because if they're truly your friends, they will be there to support you. They will say, Arnita, how can I help you? How can I support you through this? And don't be afraid to ask for help. You don't have to go it alone. It can be a lonely disease, but you don't have to be alone as you're going through this journey. Before your next doctor appointment, whether it's in person or telehealth, I want to just review a couple things. We talked about tracking your symptoms. Make sure that you have a list, if you can, a couple weeks worth of what you've tracked down for your symptoms. Think about how each of those symptoms are affecting your life. Let's say if you were triggered by the sun and you're no longer able to go to the beach with your friends, that's an impact on your life. Have you really recognized what that has meant for your life? That, it has been an intrusion, it has been, it has deterred your hanging out. Have you really recognized how that makes you feel physically, but how it makes you feel mentally, and how it makes you feel socially? Think about that. Think about your goals for treatment. Have you written down what your goals are? Perhaps lupus has affected your lungs or even your heart, and your goal might be, I just want to walk upstairs without being short of breath. Or your goal may be, I just want to get up, go into the bathroom, take a shower, and then sit down, as opposed to doing it in 3 different stages. But write down some goals for yourself and then share those goals with your healthcare provider. Make sure that you list any questions that you have. There's a statement of no question is a silly question. I absolutely 110% believe that. And I want you to believe it too. Every question that you have is important. Make sure that you ask it. Don't leave the doctor's office without having that question. And if you can't remember it, write it down. And it doesn't matter how it comes out. It doesn't have to be polished or in a certain way. Just express it. And let the doctor or the healthcare provider ask you questions based on the question that you have. If you can, ask someone to go with you to your doctor's appointment. That can be considered an appointment buddy. Hey, Arnita, I've got appointments with the neurologist on Tuesday. I'm going back to my rheumatologist on Friday. And then Friday afternoon, I'm going to see my mental health care worker. Can you go to one of those appointments with me? Or which one can you go with me? How about that? That will set you up to say, for someone to say, I can do this. I may not be able to do this, but I can do this one. And that way you have someone that's going with you. And then if you are like me, sometimes I get into the doctor's office and I go, yeah, I'm fine. That's not really how I feel, but I'm not sure how to say it. Practice. Get in front of a mirror and just practice. Okay, this is what I want to ask today, doctor. And if you have to have a piece of paper in front of you saying, okay, this is what I want to say, doctor. I want to ask you, what do my labs mean? Why is it important for me to come back every 3 or 6 months to have my labs reviewed? Write it down. It's okay. No one's judging you. It's a safe space. During your appointment, whether it's virtual or in person, have your medications list right there with you, because what your neurologist may order for you, or what your nephrologist may order for you, or what your rheumatologist may order for you, they may not have spoken, and so they don't know that they're ordering different medicines for you. And we've got to make sure that there's no problems with the different medicines that they've ordered. So make sure you have a complete list of every medication that you're taking. That also includes the over-the-counter ones. Even though the physician hasn't prescribed it and you decide you are going to start on a multivite, or you're going to start on, some other type of medication or some other type of over-the-counter, which means you go to the pharmacy, you're not standing behind the pharmacy desk getting it from them, but you're going down one of those aisles in the pharmacy and you're saying, okay, I need this. That's what means over-the-counter pharmacy. Be an active listener. Make sure that you repeat whatever the physician says. He says, okay, Arnita, I need you to take this medication 3 times a day. And I say, okay, doctor, do you mean you want me to take it in the morning, in the afternoon, at night? Or do I take it after I eat each meal? What does that mean? That way you have a very clear understanding of what 3 times a day. Let's say that you are a night owl, as we say, and you don't wake up until 11:30 or 12 o'clock. How do you get in those 3 times a day medications when they think that you might take it in the breakfast time, lunchtime, and dinner time, but you don't wake up until lunchtime? Making sure that you have that type of conversation with your healthcare provider, and consider whether or not it's time to look at another specialist to be added to your healthcare team. Telehealth. Telehealth is a title that we've given to having appointments that are not face-to-face with your healthcare provider. It's an opportunity to connect you with your healthcare provider, whether you use what's called a smartphone, a tablet, or a computer. And there's many different electronic devices that you can use, but it categorizes them in those 3 areas, whether it's a phone, a tablet, or a computer. And so before your appointment, when we think about telehealth, think about it just as much as you would if you were going into the doctor's office. So when you go into the doctor's office, what's one of the first things they do? Yes, they ask you your name, your date of birth, but then they tell you, get on the scale, right? I was just at the doctor's office a couple weeks ago, and they said, get on the scale, Arnita. I said, okay, wait, let me take off my boots, because I wanted the least amount of poundage on there. In the telehealth visit, make sure that you weigh yourself at home and write that down, because they're going to ask, and what they're asking is to see if you have gained or lost weight since the last time that you were in their office. And make sure that each time for your telehealth visit that you use the same scale. Put it in the same spot in your house, because some of us, in our houses or in our apartments or in our rooms, the floor may be a little bit tilted. So make sure you put it right at the same spot, because we want to make sure that you get the same outcome each time that you take your weight. You also know that they'll say, you'll sit on that exam table, and what they do, stick out your arm, I'm going to take your blood pressure. Make sure, if you can, that you can have your blood pressure taken at home. If you do not have access to that type of equipment at home, many of the pharmacies in the community also have a blood pressure monitoring system inside the pharmacy towards the back of the store. So make sure to go there and get your blood pressure taken. And then temperature. I would encourage you, if you do not have a thermometer already, to obtain one. Many organizations will give those out for free. And it doesn't have to be one that you stick under your tongue. It could be that little piece of paper that you put on your forehead to check your temperature. But these areas, your weight, your blood pressure, your temperature, these are areas where they will want to know this information. Because think about it, if your temperature is elevated, that could tell them that you have some type of inflammatory response in your body. They will need to know that. If your blood pressure is elevated, that could also be related to an inflammatory response. It could be related to stress. It could be related to the medication, whether you're taking it or not. And towards the end of this, we're going to talk about adherence as well. We've talked a little bit about health journaling and how important that is. You can say to your doctor, I want to send you some information. And there's an opportunity on many of the physician sites where they call it uploading information. If it's on your phone, there's a little up arrow that you can press, put in the doctor's email address, and it goes right to them. Many doctor's offices are different, so we've got to check. What's your, ask the doctor's office or the front desk when you call, how can I send my doctor some information? And you can even use the word, how do I upload some documents for my doctor to look at? I want to encourage you to wear loose-fitting clothing. Why is that? Well, I did a presentation a couple months ago, and someone said, what does that mean? Why is that important? Well, if your pants are too tight and they want to see how your ankles are looking, it's kind of hard to raise your leg if your pants are too tight, right? So have some loose-fitting clothing on. That way you're able to move around. The doctor may want to see if you say, well, I've got a little bit of something over here that I haven't seen before. They may need you to raise your shirt a little bit to show them that area. If the shirt's too tight, it's going to be a little bit challenging to do that. So make sure that you have on loose-fitting clothes. Make sure that you are in a room that is well lit. Well, what does that mean? Make sure that you have all of the lights on in the house that you can possibly have on, because if you want to show your doctor something and it's dark in the room, it's going to be very difficult for them to see that on your phone, on your camera, or on your tablet. But if you have a lot of light in your room, it makes it easier for them to see. Also, find a quiet place to have this appointment. Now, you may be in a house with 12 other people. I had one patient said to me, Arnita, the most quiet place I found was in the bathroom. I said, really? Yes, I sat on the commode and I had my telehealth visit with my doctor. I told him not to look at my surroundings, but that's where I had it. Another person said she went all the way downstairs and she was in the closet with the light on, but she was in the closet. She moved all the clothes to the side and she sat there, and that was her quiet place. So even if there are a lot of people in your home, you can make it so that it's a quiet place. And if that doesn't work, perhaps you can go to the library and ask to reserve one of their rooms, and that can be a quiet place for you as well. You can pull a curtain in that room so that it's just you and your doctor talking, and we want to make sure that you have the privacy of wherever your location is, the same type of privacy that you would have if you were one-on-one in the physician's room. Everyone doesn't need to know what's going on. It's just you and your healthcare provider. Make a list of current medication, and not just I'm taking this medication, but how much are you taking it? A lot of medications are written the number of times a day that you're taking it, but also the number of milligrams that you're taking. That often changes with your medication. What does that mean? It's a little letter M and a little letter G. How many milligrams are you taking of certain medicine? Really important to be able to share, because it changes depending upon how your body is responding to certain medications. Make sure that your device is fully charged. Make sure you have good internet access, and make sure that no one's going to come knocking on your shoulder saying, I need my phone back, or I need my tablet. Make sure that you have this time just for you. Now we are using telehealth in various settings. We're using it for follow-up appointments, opportunities that we may not necessarily need to go face-to-face with the doctor. Says, I just want to talk to you about a couple things, or I just want to review your labs with you. That may be a follow-up appointment, and that may be telehealth. You may need to just check in with your symptoms. Okay, Arnita, when you were here last week, you had these symptoms and they were causing some challenges in your life. How are you doing now? Did the rash clear up? Did the flare clear up? Or it may be a general consultation where the doctor doesn't need to physically see you in his or her office, but they just may need to talk to you. Another opportunity for telehealth. Or, doctor, you put me on X medicine. I think I'm having some side effects. So let's talk about how we can adjust that, Arnita. Let's talk about medication adjustment. And then mental health check-ins. Yeah, I'm usually stressed, but now with this flare, I feel a little bit more stressed. That may be an opportunity. You don't necessarily need to go into the office, but definitely you need to communicate with the physician, and the telehealth visit will fit in just right there. For the next few minutes, I want to talk a little bit about adherence. sticking to your treatment plan. When we talk about what is adherence, adherence means staying on your treatment plan as you and your doctor have agreed upon. Now, whether you are virtual, which means this telehealth, or you're face-to-face, adherence plays a big role in your lupus journey and helping you to live your best lupus life. Because when medication is ordered for you, the doctor or the healthcare provider thinks that you're going to take it and it's going to give you a certain outcome. But if you decide you're not going to take it, then you're not going to get the outcome that the two of you agreed that you want, or perhaps that you put as part of your goal. So adherence is so important, and you have to work together with your healthcare provider to find the right treatment for you. And make sure that you understand what all of your options are when it comes to medication. Ask questions. Even if you don't know how to ask the doctor, is there something else I can do? Is there some other medication that might help me? And then pause and wait, because it will give them opportunity to think. Perhaps they may not have thought about a certain medication for you, but your question gave them the impetus or the push to say, let me think about something else. Just try it. Staying adherent can really improve your treatment outcomes and reduce healthcare costs. Reduce healthcare costs meaning if you're staying on the medications, then maybe you may have one less flare that year. You may have one less hospitalization. You may have one less urgent care visit. That impacts a financial bottom line. Not staying adherent can cause a worsening of your condition, increase hospitalization and complications, as well as increase in higher costs. So think about the pros and cons of being adherent to the medication that you and your provider have come together and agreed upon. Coordinating your care. On this screen you see lots of different healthcare providers. All of them are important, and all of them are important to keep everyone involved and informed in all of your treatment plans and goals. Lupus is a disease that waxes and wanes, that goes to sleep like a gentle cub, that wakes up like a roaring lion. Each of these healthcare providers that are on the screen need to understand what each of them are providing or ordering for you. So if your primary care physician or your rheumatologist is the lead team member of your healthcare team, then make sure that they have told the cardiologist that this is your new treatment plan, and make sure the cardiologist has said, I've decided to put Arnita on a certain medication. I want to make sure that you're aware of it. Make sure there's that back and forth communication between them as well. This slide again reviews what is non-adherence on the left side and what it means to be more adherent on the right side. And we really want to be more adherent on the right. We want to understand how the medication works, because when we understand how it works, when we understand what the possible side effects are, we can anticipate how we can respond. So if we know if we have a side effect of it's going to make me cough, when you start coughing, you said, yes, the doctor did tell me that this was going to make me cough. I need to be aware of it. I may or may not want to go to a movie because I might be coughing during the movie. But think about it. Being more adherent, you actively engage in your treatment plan. You are actively engaged, and we talked about that in the beginning. You are actively engaged in your treatment plan just by being here and learning more about entering the room and preparing for your doctor visit and beyond the care that you're receiving. Set reminders. There's a little thing on a little clock on your phone if you have a smartphone. I use this so much. I'm so happy that it is on my phone, because I have to remind myself when to leave the house. I have to remind myself, and I give myself a little buffer. I remind myself, did you take your medications? I remind myself, you have a doctor visit in 2 weeks. Be prepared for it. Start to write down the questions that you have. Ask a buddy to attend with you if you have not already. Involve others in your care. When everyone around you knows that you need to take a certain medication twice a day, first thing you wake up and before you go to bed, you best believe they're going to say, "Did you take your medicine this morning?" Or how about you're getting ready to go down for the night, have a rest. "Oh, before you lay down, did you take your medicine?" They can help you to remember. They're almost as good as putting an alarm in, but the human part of it makes it even better. So if you can, involve others in helping you to remember. What you have before you are some websites. For our usandlupus.com website, we have a website that gives you a ton of information, and you can learn about symptom tracking. You can learn about how to register to receive a symptom tracking kit. You can even learn more about keeping your disease activity lower, which means decreasing the number of triggers. And then there's an opportunity to learn about the financial impact that lupus may have on our lives. I encourage you to visit usandlupus.com. I also, of course, encourage you to visit Kaleidoscope Fighting Lupus webpage. Between the two, we've got you covered. We've got the information that you need that will help you live your best lupus life, and that will help the caregivers in your life help you live your best lupus life. And so I want to thank you. I want to thank you for the opportunity. I want to thank you for staying the course and listening to the entire presentation. And if you had to do it in 2 settings, that's perfectly fine. You're getting the information that you need, and that's important. I also want to thank the executive director and board of directors at Kaleidoscope Fighting Lupus for this opportunity to share information with you. Thank you, and be well.
Thank you, Arnita. And in particular, thanks for those tips about planning for doctor's visits ahead of time and how to prepare for telemedicine visits. I hope everyone watching this symposium takes advantage of those resources that you offered. This brings us to the end of our symposium, Entering the Room, Preparing for Your Doctor's Visit and Beyond. We hope you found the discussion and suggestions from these experts helpful. Once again, a special thanks to our presenters, Dr. Sharon Dowell and Arnita Roberts-Christie. And thanks to our presenting sponsor, GSK, for their continued support of those living with lupus. Finally, we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, and award-winning blog articles, and so much more. Thank you for spending time with us. And remember, you are not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Please take care.